Hello coders, how are you? Hope you are all doing fine. Today's video is about some commonly asked questions in the medical coding interviews. So first question is, what is medical coding? So this is the definition of medical coding. Medical coding is a process that involves analysis of patient's medical record to translate healthcare diagnosis, procedures, medical services into universal alphanumeric codes. Medical coding is a process that involves analysis of the patient's medical record for what to translate the diseases, procedures and medical services present in the medical record into alphanumeric codes. So we go through one example of medical record from which we will code the diagnosis, the disease of the patient. So here is the example of patient record. This is a progress note of a patient. So this is a progress note contains problem list and history of present illness. So in the problem list, the patient is having acquired hypothyroidism, papillary carcinoma of the thyroid gland, status post total thyroidectomy in 1992. So thyroidectomy means ectomy of the thyroid gland. It means surgical removal of the thyroid gland. So the patient is having papillary carcinoma. Further, the patient has undergone thyroidectomy, means the patient thyroid gland of the patient is removed. Third is diabetes mellitus. Fourth is insomnia with sleep apnea. So this is history of present illness. The patient came for return visit to the endocrine clinic. The patient returned to the clinic for hypothyroidism. So next is medications. The patient is on levothyroxine, glucotrol and synthroid. Next is review of systems. Next is physical exam done by the physician. Next is some laboratory details. Last is assessment plan. In assessment and plan, we have acquired hypothyroidism. The plan to continue following thyroglobulin levels. So for this chart, we will give codes for acquired hypothyroidism, but the patient has undergone thyroidectomy. For that, because of removal of thyroid gland, he is getting hypothyroidism. So we will give code E89.0, post-procedural hypothyroidism. And patient is also having diabetes mellitus in the problem list. So patient is having diabetes mellitus. So for diabetes mellitus, E11.9. And for total thyroidectomy, we will give E89.0. So total 2 codes will come in this chart. So like this, in medical coding, we will analyze the patient data, patient medical record, and translate the medical diagnosis, procedures and services into alphanumeric codes. Next is, what is ICD-10-CM? ICD-10-CM full form is International Classification of Diseases, 10th revision, and CM means clinical modification. So we usually remember this International Classification of Diseases, but they will ask about CM also. CM means clinical modification. So who is managing this? This ICD-10-CM is managed by WHO, World Health Organization, and it is revised in October. What is the importance of ICD-10? It is a system used by physicians and other healthcare providers to code the diagnosis during the hospital care. So this ICD-10 is diseases. So it is used to code the diseases, diagnosis of the patients during the hospital care. So the system is used by the physicians. And next is, what is CPT? CPT is current procedural terminology. This is maintained by American Medical Association, AMA, American Medical Association, and it is revised in every January. What CPT describes? CPT describes the medical, surgical and diagnostic services. CPT is current procedural terminology maintained by AMA, American Medical Association, and revised in January. So they will ask like this, what is the difference between ICD-10 and CPT? We have to describe this ICD-10 and CPT. Next is, what is HIPAA? HIPAA means Healthcare Common Procedural Coding System. HIPAA identifies supplies, products and services not included in the CPT. So whatever the products and services that are not included in the CPT are covered in HIPAA. Next, tell me about different series in the CPT. So CPT codes are divided into 6 main sections. They are Evaluation Management Course 99,000 series. Anesthesia. Surgery 10,000 to 60,000 series comes under surgery. Radiological procedures 70,000. Pathology and laboratory services are covered under 80,000 series. Medicine services and processes are covered under 90,000 series. Next, surgery. Surgery is further divided according to the systems. 10,000 series, 20,000 series includes musculoskeletal system. 30,000 series contains respiratory, cardiovascular and lymphatic system. 40,000 series digestive system. 50,000 series includes urinary system, reproductive system, male and female. And the last one is 60,000 series endocrine system, nervous system, eye and ear. Next, what are modifiers? So this is very important question. And if you are attending for ED or surgery, what are modifiers? Modifiers are two characters, maybe numbers or letters, that are linked to the code to provide additional information about the medical procedure or service performed. These modifiers provide additional information, extra information about the procedure or service performed, which the code does not contain the information. That information is provided by these two characters. Example are modifier 52 is used for reduced procedure. Reduced procedure means, for example, physician must take 4 views of the chest X-ray. So chest views he has to take 4, but he only took 3, and he is okay with the 3 views, and he thought that there is no need of the 4th view. So he intentionally took less number of views. So this is called reduced procedure. For that we have to give modifier 52 along with the CPT code. Next example is modifier 53. This is the discontinued procedure. Discontinued procedure means, for example, when the physician is performing this procedure, EGD procedure, esophageal gastroduodenoscopy, and the patient was bleeding. Like patient, not only bleeding, if the patient BP is down, like that, if the patient is getting any complications, then physician thought that it is not good for the patient and discontinued the procedure there itself. So for that procedure, we have to give modifier 53, because he discontinued the procedure because of the well-being of the patient. Here the patient is fine, but the physician only took the decision of taking less number of views. Here because for the patient's well-being, and the physician discontinued the procedure. So we have to give modifier 53. So this is the example for modifier 53, and this is the example for 52. Sometimes they will ask only definition, but sometimes they will go in depth about to explain some modifiers, not only 52 or 53, some other modifiers also, and they will ask for some examples. So we can give these examples for 52 and 53. So next is, what is full form of HIPAA? HIPAA means Health Insurance Portability and Accountability Act. This act is a federal law. It is the act of USA. It is a federal law that set up standards to protect sensitive patient data. So it will tell the rules and regulations the companies or third parties that have to follow to protect the patient's data. The data is sensitive, so it will set up the standards, rules and regulations to protect this data. So it is like IRDA in India. So what is IRDA? Insurance Regulatory and Development Authority of India, IRDA. So hope you like this video. If you like this video, kindly like, share and subscribe to my channel. Thank you for watching.